Objective questions, MCQ in English. Subjects, nursing, general knowledge, reasoning, general English, mathematical aptitude. Question bank KGMU Nursing Officer Exam, English. Question 1. Pathogenic organisms are A. Used in the pasteurization process. B. More plentiful than any other type of organism. C. Important to industry. D. Harmful to humans. Question 2. For giving CPCR, after ascertaining unresponsiveness one should A. Call for help. B. Establish an airway. C. Check the carotid pulse. D. Give chest compression. Question 3. Local cold application transfer heat from the body by A. Radiation. B. Evaporation. D. Conduction. Question 4. Autoclaving, a means of sterilization, will destroy A. All microorganisms. B. Pathogenic microorganisms. C. Non-pathogenic microorganisms. D. Just yeasts and molds. Question 5. A euro position in which the patient is to be cared after lower extremity amputation is A. Left lateral. B. Supine with head turned to one side. D. Prone. Question 6. When giving a patient intramuscular preoperative medications, the practical nurse must remember to inject into site no more than A. 1 milliliter. B. 2 milliliters. Question 7. The safest position for a lady with cord prolapse in labor is A. Fowler's position. B. Prone. C. Supine. D. Trendelenburg. Question 8. The percentage of water in human body is A. 60%. B. 80%. D. None of these. Question 9. Daily care of patient's room would consist of A. Disinfecting and sterilizing items in his immediate area. B. Providing fresh water for his flowers. C. Scrubbing and waxing the floor. D. Damp dusting and straightening. Question 10. The most important electrolyte of intracellular fluid is A. Potassium. B. Calcium. D. Chloride. Question 11. During the bath, observation of skin include A. Temperature, integrity and condition. B. Color, warmth and bruising. C. Markings made by wrinkles in the sheet or crumbs. D. Distribution and color of hair. A. Supine position. B. Fowler's position. D. Side-lying position. A. Subjective and objective observation. B. Communications of the patient. D. Recording of all data in a legal manner. B. Sodium bromide. D. Calcium chloride. A. Systolic BP. B. Hypothermia. D. Widening pulse pressure. A. Redness, pain, swelling and decreased temperature. B. Increase and decreased blood pressure. D. Increased temperature, pain, redness and decreased urine output. B. Lows. Question 18. The physician writes the following order: obtain a sterile urine specimen for CNS. Which of the following is true concerning a sterile urine specimen? A. May be obtained from the catheter bag if the patient has a Foley catheter. B. May be obtained using the clean catch or midstream method as long as you use a sterile container. C. Must be obtained either by catheterizing the patient or from the catheter itself if the patient has a Foley catheter. D. May be obtained only by clamping off a Foley catheter for 15 minutes and then taking the specimen from the catheter tubing. A. Oxyhood. B. Face mask. A. Oxyhood. B. Nasal cannula. Question 21. Nursing observation that should be reported to physician immediately include A. Pulse, hypotension and decreased urinary output. B. Obstruction of the intravenous tubing and inflammation at the puncture site. D. 350 mm of yellow-green drainage from nasogastric tube during the 8-hour shift. A. Aerosol mask. B. Venturi mask. D. Non-rebreather mask. Question 23. To check the placement of nasogastric tube, the nurse can A. Order a chest X-ray examination after injecting SCE of air into the stomach. B. Ask the patient if the tube feels as if it is in the stomach. C. Ask the patient to take 3 deep breaths while pinching the nasogastric tube. D. Inject 5 cc of air into the nasogastric tube while listening with a stethoscope for air entering the stomach. B. Venturi mask. D. Non-rebreather mask. B. 65 milliliters per kilogram body weight. D. 100 milliliters per kilogram body weight. B. Hemorrhage. B. Otoscope. B. Do deep breathing and coughing exercises. C. Shave the skin. D. Regulate IV accurately. B. Gauze. D. Cables. B. Prone pressure. B. Do deep breathing and coughing exercises. B. Direct pressure to the wound. B. Galileo Galilei. A. Profuse perspiration, normal body temperature, fainting. B. Unconsciousness, incontinence and bradycardia. D. Flushed face, rigidity of body muscles and excessive salivation. B. 94 to 110. B. 22 to 25 per minute. B. Ask him about his faith because you may not agree with his religious belief. D. Ignore his request, realizing that illness after causes a patient concern about spiritual welfare. B. Leave the wound uncovered and pull the skin edges together. B. Every 60 minutes. B. 25 to 40 milligrams, 100 milliliters of whole blood. B. Proper administration of antibiotics. B. Perineum. B. Patient identification and correct operative consent. B. Itching of the part. B. Cholestatic hepatitis. B. Medication preference and location. B. None of the above. B. The upper airway is no longer connected to the lower airway. B. The expected duration of catheterization. B. Increase the oxygen content coming 10 contact with the mucous membranes. Question for KGMU nursing officer.